Australia is this morning entering a new normal. Our borders are effectively shut down. Businesses are telling employees to stay home. And sports are cancelled, all being played in front of empty stadiums.
But the government's decision not to close schools have left many confused. And joining us now is Federal Education Minister Dan Tehan. Minister, thank you so much for your time this morning.
Pleasure, Ali.
Well, look, if you just look at it now, 61 countries have now closed their schools in some capacity. Why are we not doing the same?
Well, I know this is a worrying time for parents, but what we're doing at a federal government level and all state and territory governments are doing is listening to the very best medical advice available to us. And that medical advice is telling us at this stage we should leave schools open. And there are two main reasons why we're doing that, because the advice is saying if we shut them now, then children would be at home. In many cases, they'd have to be looked after by grandparents or the elderly, and that could pose a risk to them. And also, we need the workforce at the moment. We want to make sure that we've got our nurses, our allied health workers, our doctors working, and we need our kids at school. There are 3 million children at school, so that's the very best medical advice at this stage. And can I say to all those school principals out there, I know this is a difficult time for you, but we are listening to the best experts in the world on this, and we want to work with you to make sure that you're reassuring parents and that they know that you're doing the right thing.
OK, the advice from the Prime Minister yesterday is stand or at least be sitting 1.5 metres away from someone else. Even my daughter yesterday, at 14 years of age, said to me, "Dad, we're a lot closer than that at school." There's got to be a common sense attitude here, doesn't there? And look at Spain, the US and France, they've all closed their schools. I mean, surely it's inevitable.
Look, there might come a stage, definitely, where the medical experts tell us it's time to close schools, but that moment isn't now, and we have to listen to the medical experts. There will be a lot of people who'll have a lot of theories about when we should be doing various things, but the government's position has been clear. Let's listen to the best medical advice.
But if you say, if you just comment, Minister, I'm sorry. You say,
right.
Please give a distance of 1.5 metres away from everyone socially, and our kids are far less than that. I mean, the difference in advice here and the discrepancies in advice is mind-blowing. And which is it? Is it 1.5 metres or is it OK to be 30 centimetres?
Well, when it comes to schools, state and territory education ministers have put advice out yesterday about the type of social distancing practices which should occur at schools, and also about the basic hygiene, especially hand washing, that needs to be taking place. And that's once again all based on the best medical advice. Now, there might come a time where this changes down the track, but that's the advice we're getting now, and that's what we have to listen to. Because if we don't, and we base it on different theories here or different theories there, what we'll lead to is no one will have a clear idea of what the simple message is. And that's why we're listening to the best medical advice.
Well, Minister, I mean, your school holidays, they're just around the corner. What is going to happen then? I mean, is the advice to keep the kids at home as much as possible? Are you still encouraging people to holiday locally?
So we will continue to update the advice. The Premiers and the Prime Minister will meet again on Friday, and there will be further advice which follows from there. As I've said previously, there might come a stage where the medical advice says maybe the school holidays need to be extended for a week. There might be other measures that need to be put in place. But at this stage, the medical advice is very clear. We want our students at school for the two reasons that I mentioned.
It's all over the shop. You're saying at one point, OK, we need our kids to be at school so that they're not running around together and then they're not spreading the virus. And then you're saying, oh, hang on a second, we might have to extend the school holidays. Which is it?
Well, Carl, what I'm saying is that the advice may change.
Okay.
At this stage, what we're saying is that students should be at school for those two reasons. And we would call on all parents to do the right thing. We've got to make sure that we deal with this virus, the threat of this virus, in a very systematic way. And the best way that we can do that is listen to the medical experts.
Okay, Minister, we appreciate your time this morning. Now, the killer bug has claimed more lives in Australia with confirmation overnight. 2 elderly patients have died, bringing the national death toll to 5, while the number of cases locally has soared to almost 300.
Dr Danielle McMullen is the Deputy President of the AMA New South Wales and joins us now. Danielle, you heard the Minister there. Do you agree?
I couldn't hear what the Minister was saying, unfortunately, on the link, but I know the health advice for students is conflicting, and so that's why there's been a real difficulty deciding what to do.
Should our kids be going to schools?
We do think, like with COVID-19, children haven't been a high-risk group so far, and the social consequences of shutting schools and then parents who may also be your health workers having to stay home to look after them make it a really complex issue. So it is frustrating that it's changing day to day, but we've got to see how it plays out.
So he just said that, and you didn't hear it, but he said, OK, we don't want all the kids at home because they can spread the virus more readily, and there's all sorts of social implications. However, if they're home at the school holidays, they may have to stay home longer. I mean, I can't. I find it upsetting with the conflicting information.
We then have to go. Remember, this is changing every day. So the advice today is that schools don't need to be closing as of now, but by the school holidays in a couple of weeks, we don't know. We've really got to watch how this goes, and they may well need to change advice.
Well, I mean, the Minister made the point that often if these kids do stay home, that it's probably going to have to be the grandparents who look after them in a lot of cases, and that's what, you know, a lot of our focus is with coronavirus, is our elderly. We've got, you know, the most recent deaths was a 77-year-old and a 90-year-old. Yeah. I mean, just how concerned should we be for them at the moment?
We need to be concerned. We know that COVID-19 is more likely to cause a severe illness in the elderly, but also things like this panicked supermarket shopping and even sensible measures like social distancing tend to disadvantage our elderly.
In Great Britain this morning, they've announced, and we'll be putting this to the Premier as well, that the elderly may be in isolation for up to 4 months. They should be planning to do that. Is that a measure that we should be taking here with our high-risk groups? High-risk groups that include also people who are just sick, people who are undergoing chemotherapy, a whole raft of things. Do we need to be isolating these people? And that's a terribly long time, but is it that necessary?
At the moment, those people do need to at least be practising stronger social distancing than the rest of us do. And yes, it sounds extreme, but these are unprecedented times. At the moment, we don't think they need to be locked inside and never to leave, but certainly not shopping at peak times, or ideally getting someone else to do the shopping for them. And they're the people to be really trying to stick to that 1.5 metres if possible.
Yeah, I mean, and that's the thing that is difficult, isn't it? This is sort of 1.5 metres at all times.
Well, I mean, we're here in front of the nation, Ali and I, and we're less than 1.5 metres. I mean, we're trying to do our best, but there are practicalities, aren't there?
That's it, and we've got to remember that everyone is trying to do their best.
Thank you for your time again, really appreciate it. OK, joining us now is New South Wales Premier Gladys Berejiklian. Premier, good morning to you. You've had another busy weekend, I see. We've had a confirmation overnight of 2 more fatalities in New South Wales. As I just said, then Great Britain has announced the elderly should be in isolation for up to 4 months. Should we be taking those steps as well now?
Oh, look, Carl, we're definitely looking at what we can do further to protect the most vulnerable and those who are aged, and that's definitely something that's going to be on the agenda of the National Cabinet, and here in New South Wales it's an absolute priority for us. But at this stage we ask everybody to take a sensible approach, and I just heard before, I think a representative from the AMA and others talking about how the elderly in particular can take extra steps during this time, but we'll have more to say about that in the next few days. And we know, unfortunately, that it is impacting a certain age group more than any other. It's a matter of time before it becomes more widespread, and our aim at the moment is just to reduce the spread. If we manage to reduce the spread, we will have obviously greater lives saved in the next few weeks and months.
And I think it's really important to keep in mind that we've had 5 deaths. I think the issue is, of course, when you look at this graph and how it is, travelling exponentially. And the number of cases in New South Wales is double that of any other state. I mean, would you consider a lockdown to try and slow the spread?
Oh, look, we're not there yet, but I say to you, Carl and Ellie, and to all of our citizens here in New South Wales, we will be safe rather than sorry. We'll make sure we take any decision we need to keep our people safe. I don't shy away from that. This is a life and death situation, and we've seen how very dramatically in some countries the number of cases really went up, the number of deaths went up very suddenly. So all we ask is for the community to be alert, to please listen to the instructions we're given. We know it's not perfect. There are some people who are saying there's advice which might conflict with others, but generally speaking, I think the advice is solid. For elderly people in particular are extra vulnerable. I'm taking precautions with my own parents, and I'm sure everybody else is as well. And we ask people to be sensible, but also think of others. You might feel okay, you might think you've got the resistance, but imagine unintentionally giving it to somebody who then ends up losing their life, and that's the last thing we want to see.
So,
we're asking everybody to respect each other during this process.
So the mandatory self-isolation period now, Premier, for anyone flying in from overseas is now in place at 14 days. What happens, for example, when someone flies in from another country, we're not sure about their medical history and who they've come in contact with, whether or not they have the virus or not? They go into a cab, they go into an Uber, they're surrounded by other people, and when they get home, I mean, it's very difficult to contain, isn't it? And what happens to the cabin staff on planes?
Oh, it is very difficult. We're told that cabin staff and crew are given the extra equipment and taking every precaution. And obviously when people land at the borders, they'll be given some type of information from the customs people, and those details will come to pass in the next few hours in terms of the specific way to implement it. But in New South Wales, we've invoked our Health Act, the emergency provisions we have in there. So if we know for a fact that somebody is doing the wrong thing intentionally or otherwise, the Chief Medical Officer can intervene, and obviously the police can be involved. But we don't want it to come to that. This is about being safe and sensible, but also not assuming it won't happen to you. I mean, we've heard overnight a number of people who are household names who've now got the virus. It can happen to you. Take this seriously. It is not something that we can kind of say isn't going to happen to us. It can happen to any of us. And I'm also pleased to say that we've provided a bit of certainty last night in relation to mass gatherings here in New South Wales. We're being very black and white about it. We'd rather people were safe rather than sorry. We're asking them to cancel any events which were planned with more than 500 people gathered at any one time. And we think that's a safe thing to do.
And Premier, we've been talking this morning about how much small businesses are hurting, that people will be losing their jobs. The federal government came out and announced their economic rescue package. When will you be detailing what stimulus you'll be offering?
Oh, well, we've said that'll happen this week, and the reason we're doing that is we want to make sure that every dollar we put towards this is exactly where it's needed. And we're asking everybody to think about a 6-month plan, and we know for a lot of small businesses that's going to be really hard. But at the end of the 6-month plan, I say to people, the next 6 months is probably going to be the worst for all of us. But the 6 months after that, hopefully, will be full of the opposite. And so let's help each other get through the next 6 months, and that's why we're thinking hard about what is the best way we can do to support the community. But I do also have to say my primary focus is injecting extra dollars into healthcare. We want to make sure we've got the extra ICU beds, we've got the extra beds available in our hospitals, because the focus very soon will change from the number of cases to the number of people being admitted into hospital. We've tested over 20,000 people in New South Wales. The number of cases is a fraction of that, but that's going to change overnight. It just takes, once you have a critical mass of people who've got it, the spread is very quick.